Provider lists. Create a location list. The location list is set up by you and is automatically updated as patients are admitted and discharged from the location list you have identified. To start creating your list, click on the Patient List icon in the toolbar. To create a new list, select the List Maintenance icon, which resembles a wrench. You want to create a location list, click New. Select Location and click Next. From the options on the left, select Locations. To display the St. John Providence Health System locations, click the plus sign by Locations on the right side. Scroll down until St. John Hospital and Medical Center displays, and then select the plus sign before the location. Click the plus sign in front of SJH and the list of available units will display. You have patients that are located in 4 peds at St. John Hospital. Select the checkbox before that unit and notice that the unit you selected now displays in the name field below. Next, click the checkbox for discharge criteria from the options on the left. Select the radio button next to Only Display Patients that have not been discharged. Choosing this option will ensure that only patients that are currently in the hospital will appear on the list. You have no further filters to select and are done with creating this list. Click Finish. To activate the list you created, select the name of the list on the left and click the blue right-facing arrow to move the list to the Active List pane. The list has been moved to the Active List pane. Click OK. The list of patients located in 4 peds at St. John Hospital now displays. Create a relationship list. The relationship list is set up by you and is automatically updated as the type of patient for which you identify your relationship are admitted and discharged. The most common relationships selected are admitting physician, attending physician, and consulting physician. If a provider sees patients at several different sites, a different relationship list for each must be created. Residents do not need to create a relationship list as there will be a proxy list given to you from another provider. To create your relationship list, click New. From the options listed, select Relationship and click Next. Click the plus sign before Visit Relationships to display the available options. You now want to select the relationships for which you want to be identified. Select the checkbox before Admitting Physician, Attending Physician, and Consulting Physician. You now want to identify the locations for your list. On the left, select Locations and then double-click on Locations to the right. Scroll down to St. John Hospital and Medical Center and then select the plus sign to display the available options, and then click the plus sign in front of SJH. Select all of the locations you want included in your relationship list. When finished, select Discharge Criteria from the menu on the left. You only want to see the patients that have not been discharged in your relationship list and will need to select the appropriate radio button. You've added all of the filters you want to include in your list. If you wish, you can rename your list by typing the desired name in the box at the bottom of the screen. Select the relationship list from the left-hand side and click the blue arrow to move the list to the Active List pane. Your available list now displays in the Active List field. When finished, click OK. You will now see the Admitting, Attending, and Consulting Physician tab on your patient list screen. The patients that fit the criteria you selected will display. Create a custom list. A custom list is created by you in which you add or remove patients of your choosing. You would like to have quick access to the patients in the Macomb Hospital 4th floor with diabetes, so you may quickly page through their results with access to their charts. To create your list, click New. Select Custom and then click Next. You want to name your custom list Diabetes, so you will type Diabetes in the field below and then select Finish. To activate the diabetes list, select Diabetes and click the blue arrow to move this list to the active pane. You also see the location of Macomb Hospital 4th floor, so select that in this screen as well. Once you've selected the options you want in your active list pane, click OK to finish this process. You are now ready to add the diabetic patients to your new custom list. Those patients can be copied from your Macomb Hospital 4th floor location tab. To select the patients you want to include in your custom list, hold down the Shift key on your keyboard and select the first patient on the list with the visit reason of diabetes. While continuing to hold down the Shift key, select the rest of the patients with the same visit reason. Click the Copy Toolbar button, which is the icon that resembles two sheets of paper, to select the patient you want to copy to your Diabetes tab. Select the Diabetes tab and the list will initially be blank. To paste the names you just selected to the custom diabetes list, click the Paste button, which resembles a clipboard, and your patients will now be listed under the Diabetes tab. Patients who are on a custom list remain on the list until you actually remove them by using the Delete Patient Toolbar button, which resembles a person with a red X. You also have the ability to add a patient using the Add Patient Toolbar button. To add a patient to your list from the toolbar, click the Add Patient Toolbar button, which resembles a person with a yellow star. Your patient Lily Aldrin's pre-surgical testing identified that she may be diabetic. She is being transferred from inpatient surgery to your unit and you want to add her to your custom list. Click the Add Patient Toolbar button. When the patient search window opens, type in the patient's name. When the patient is found, select the active encounter and click OK. Lily Aldrin's name has been added to your custom list and you can review her results so you'll be ready for her arrival. You have completed the video for provider lists. Thank you.